Shall we start, ma'am?
Yeah, we can. Am I audible to everyone? Just raise your hands, please. Yeah, thanks. Good morning, everyone, and welcome to our webinar on Text-Neck syndrome. I'm Sampada from Buddy for Health from marketing team, and I will be your host for today's session. So before we dive in, I want to convey our hearty thanks to everyone who showed up interest and join us today. Many of us feel neck pain due to our digital habits, both personally and professionally. So we all know neck pain is real, but knowledge is power. So today we will explore causes, symptoms, and most importantly, expert medical solutions. We have expert insights, practical tips, and a live Q&A session for all your questions, and as well as exciting offers on health checkup packages for our attendees. So do stay till the end, and I request you all to drop any questions you may have in the chat. Uh, just I will just change the slide. I would now like to invite our co-founder Nikki Jain to speak a few words. Nikki is qualified and experienced company secretary. As our co-founder, she has been instrumental in shaping our vision and driving our growth. Over to you, Nikki, ma'am. Nikki, you're on mute.
We are an omni-channel healthcare service provider that offers a wide range of preventive healthcare solutions for corporate and individual with pan-India servicing across 4,500 pin codes. Along with our top-notch accredited partner labs, we provide state-of-the-art pathology and radiology services as well as holistic healthcare solutions. We offer 100 plus health packages and 500 plus individual tests that cover a spectrum of parameters and come at attractive prices with accurate and timely reports. Our goal is to help people detect, treat health issues before it's too late by providing regular checkups in today's hectic lifestyle. I'm introducing Dr. Ranjitha Naini, ma'am. She is assistant professor at Shaadan College of Physiotherapy, Hyderabad. She is an M.P.T in Orthopaedics and Sports. She is certified yoga therapist and instructor and a diabetes educator. Over to you, ma'am.
Hello, everyone. So, do you know everybody about this Text-Neck syndrome? Text-Neck syndrome. So, it is also known as a turtleneck syndrome. This is the term coined by US chiropractitioner D.L. Fishman in 2008. So, this Text-Neck syndrome is caused due to repeated strain over the neck muscles. And what will be the clinical features? Mainly, the pain will be in the shoulder area and also the pain in the neck. This is due to excessive watching of smart gadgets or laptops. So how we have to hold it, how we have to see the laptop, at what level the laptop should be, at what level we have to see our gadget. So how it is leading to excessive strain over the neck, and it is leading to text neck syndrome. So it has been prevalence more this nowadays. So it is also called as turtleneck syndrome. See the difference, the same type, the turtleneck, the head is also, our posture is also like this only, the same. Next slide. So we are seeing more in urban areas than in rural areas, because in urban areas after COVID pandemic, everyone you are using the smart gadgets. Everyone, even the students, and also the corporate officials, they are doing work from home, and they are doing prolonged period of time, and working hours are more also. So this is how we are seeing more in urban area than in rural area. And commonest age groups will be seeing 20 to 40 years of age. That is from students' life. So they are using. So whenever we start our day with by seeing the phone only. So after getting up, first we see our phone. So how we have to see the phone also, it is very important. And coming to females are more than males. So this is again due to their weak musculature. Is one of the prevalence. And in occupations, IT professionals. So those who are sitting for prolonged period of time, more working hours, more than 9 hours who are doing. And in students, so students with COVID pandemic, everyone. So the even the classes, everything will be in the smart gadgets and desktop workers. These are the people who are commonly affected with this posture. Next. So what are the causes? Imbalance in the cervical musculature, excessive use of mobile phones, excessive use of computers and laptops, prolonged study hours, and prolonged office hours. So this is mainly seen in clerical jobs and also in the lab workers who are doing lab diagnostic works. Next slide. So what are the risk factors? There are no routine exercises. So I will recommend every individual, they have to do 150 minutes of exercise per week. So those who are having sedentary lifestyle also, not even doing exercise at least 5 to 10 minutes a day, and weak cervical musculature, this is due to prolonged sitting and seeing the gadgets or laptops, and no postural care. How will we sit? If you sit for more than 2 hours in a chair also, we will slouch ourselves. So we will not sit straight. We will sit in a slouched posture or by keeping like this. So these are leading to postural biomechanics. So this biomechanics can be changed. And lack of sleep, this is seen in many corporate officials. Lack of sleep is leading to anxiety, anxiety leading to frustration, and frustration leading to lack of imbalance in the muscles, which is again leading to this neck problems or muscle related problems more. And improper sleep positions, this is very important. How do you have to place the pillow while sleeping? So many of us, though we know the sleeping positions also, the pillow position also, in between the sleep we get out of it. So next slide. So this is the pillow how we will keep generally. So there will be a gap between our head and the neck and the shoulder level. This is how we sleep. But actually, there should be no gap between the neck to the head and to the shoulder. The gap should be filled with the pillow. Either you lie in the side lying or in the supine lying. The gap should not be there. And many of have a myth that if we are having neck pain, we should not use pillow. This is a myth only. The fact is, whenever we are having the neck pain, the muscles will be weak. So when muscles are weak, support is required. So pillow is must when there is a cervical pain. So this is the correct optimal posture how we have to use the pillow. So a neck support should be there. Next slide. So what are the clinical features? There will be neck pain radiating to shoulder pain, rounded shoulders. Many of the officials who are doing corporate works, so they will be having these rounded shoulders at very young age. From 25 years of age, I am seeing many patients will come to me having this type of rounded shoulders because of prolonged period of work. And upper back pain will be seen more. Headache will is the one of the first sign having this text neck syndrome or forward head neck posture. Dizziness, then vertigo. This vertigo is the last symptom where after seeing the laptop also sometimes if you move our head to side also we feel vertigo and dizziness. Next slide. So these are the symptoms: headache, pain over neck region, over the upper back region will be more, and tingling sensation will be seen. So it will be radiating from neck region to fingers region also. And also postural. Postural change can be seen. So with all these, there will be problems in breathing also. Difficulty in breathing, muscle spasm. Muscle spasms can be seen over the upper back area more, and also the problems in vision. So there is a vision. So prolonged period of time seeing the laptop. So our vision will be only in one direction. So with this also there will be text neck syndrome or turtleneck posture or forward head neck posture. So this forward head neck posture, again, it may leads to many of the problems. So next slide. So this is the how with 15 degrees. So morning, when we get up in the morning, so first time we will see our phone. So how we will see our phone? See, 15 degrees of neck bending, how much weight is borne on the spine? 12 kg of weight, 30 degrees and 45 degrees of neck posture. So this is the posture how we will be seeing. That means how much the posture change will be there. So normally we have to see our gadgets up to the eye level. We have to keep it up to the eye level, but we will see like this. So how the postural change it occurs, how much weight will be borne on the spine. So this forward neck posture, further it may leads to, if we have not taken proper care also, it may leads to upper crossed syndrome, where many of the corporate officials nowadays are coming with this problem. See the neck posture, how it will be. So the neck curvature, it should be in S shape. It goes into straight level. What will happen? There will be tightness over upper muscles, upper back muscles, sorry, tightness over chest muscles, and weakness over the neck muscles. So posterior neck muscles also goes into tightness, and upper back muscles will go into weakness. So what all happens when these muscles will go, chest muscles will go into tightness, there will be breathing problems. So this is the spine after seeing prolonged period of time, how our spine posture changes. This is due to the gravity, force exerted by the gravity. The neck muscles has to compensate it. In order to compensate it, we keep our head forward. So what will happen when we keep our head? So how our posture changes. So our neck should be like this, spine should be. But on prolonged seeing of the screen time, if increase the screen time, our neck posture and also the cervical bones also, there will be change in the structure of the bone. Next. So prevention, avoid excessive uses of smart gadgets. Frequent breaks during working hours. This is very important. For every 2 hours, you have to take the break, and routine monthly screening. This is very important. The cervical muscles, if we have any cervical spondylosis problem, monthly screening should be done with physiotherapist, and proper ergonomic care. That means how the chair should be, at what level the chair should be, and the screen should be, and exercises. So every 2 hours, there are some exercises. If you do it, we can prevent it. Ergonomic care is nothing but how we have to take care of our spine, entire thing, our musculature. Next. So this is the posture, slouched posture, what we will be sitting when we are seeing the laptop or screen time. So normally you have to sit straight, sit straight. So you have to bear weight on both buttocks, and the back support should be there, and the keyboard should be up to the level of the elbow. So and the elbow should be of 90 degrees, and screen should be up to the eye level. So this is how on prolonged usage of screen, how we will change our posture. But actually students also while reading, they have to keep the book up to the eye level. So and also I told the pillow is very important. So many of them, they will not place pillow if they have cervical pain. But pillow, there should be support should be there to the neck, to the head and to the shoulder. So this is the common posture. Monitor should be at the eye level, keyboard at elbow height, and there is a lumbar support chair. And if you have back pain also, you can place a pillow over the lumbar support. So that is, see, head should be up, shoulder should be relaxed and retracted, elbow at sides, it should be at 90 degrees, and wrist in neutral position, and back with S-shaped curve. So this is the chair. So maintain erect posture with more neck and shoulders relaxed. Keep upper arms close to the body. Elbows should be 90 to 100 degrees. And this is very important. Keep feet flat on the ground. How we will sit? So we will not sit on both buttocks. We will be sitting either on one buttock, and we will be leaning like this, or our feet will also should be flat on the ground with weight on the buttocks. So avoid bending neck forward for prolonged period of time. So For every 2 hours, a change in position should be done. Next. This is the chair, how we have to use. It should be non-slippery and it should be having back support. So a keyboard level should be a bit low from the monitor level and the keyboard level should be in level to the elbow. So chin down, eyes level with top of the monitor. So elbow should be close to the body and back support for curve to maintain the curve of the spine and feet should be flat on the floor. So what are the treatment goals? So first is to reduce pain, to increase the range of motion over the joints, to reduce spasm, to reduce functional limitations, and to increase muscle strength, to correct the biomechanics of the posture, to reduce the inflammation, and to relieve neurological compression if exists. That is in case of cervical spondylosis. So what we use in physiotherapy is electrotherapy modalities, IFT, ultrasound we will be using, and hydrocollateral packs are nothing but hot packs, ice packs, TENS machine we will be using for to reduce pain, and laser. So treatment mainly includes strengthening exercises, stretching exercises, mobility exercises, breathing exercises, and shoulder braces. If the pain is not reduced, shoulder brace is advised. So what will be the main? We will be concentrating on scapular stabilizing exercises, shoulder strengthening exercises, and cervical stabilizing exercises. This is one of the cervical stabilizing exercises, chin tuck-ins. So how many times we have to do this? So this should be done for 10 times a day. So at least for every 2 hours. So in order to maintain the curvature of the neck. Next, shoulder shrugs. So shoulder shrugs are very important. Every 1 hour we used to prescribe for the any corporate officials who are having the neck pain, even for cervical spondylosis patients also. So shoulder shrugging should be done. So shoulders, we have to lift the shoulders and you have to make it to touch to your ears and count 1, 2, 3, 4, 5 and slowly release it. So shoulder shrugs, and this is the to maintain the static neck muscles. So these are known as isometrics. So here you have to keep your hand, apply pressure to hand from hand to the head. At the same time, from the head you have to apply equal pressure to the hand. So these are the some of the cervical neck stabilizing exercises. So this is of T-shape exercises to maintain the shoulder scapular muscles, to maintain the shoulder retraction, protraction and retraction. Next, shoulder squeeze. So shoulder squeeze, same as shoulder shrugs. Before doing this, first you have to lift the shoulders and then shoulder squeeze. So this is very important exercise. For every 2 hours, if you do it, we can prevent the neck pain also. So these are with the dumbbells, one of the strengthening exercises, how we have to lie at the end of the couch or at the table. So hold 1 kg weight or half kg weight, depending upon the weight of the individual. We will prescribe the weights to the person. So we will ask them to go for flexion, extension, abduction, protraction, retraction movements. Next is next slide. Hello.
Yeah, I think it got stuck in between. Just a minute.
Okay. So
There is some technical glitch. Give me some time.
okay, okay. So these are the some of the stretchings we will be done by the physiotherapist. Apart from this, self stretches are also there. So this is about occipital stretch. This can be done while doing the work also of every 2 hours for about 10 times. Just stretching the head. And this is sideways stretching, scalene stretching. Next, suboccipital stretching. This is one of the self stretching technique which can be done by the individual itself. Breathing exercises are very important. Everyone, you know about the yoga also, pranayama techniques, breathing in and breathing out. A very important every 2 hours, breathe in, breathe out at least 5 times. This is very important. Breathe in, you abdomen should be relaxed. Breathe out, abdomen should go inside along with the rise of pelvic floor. So if pain is not reduced, if they are suffering with forward neck posture, neck pain and cervical spondylosis, this is one of the shoulder retractor base where we will be advised so that it can maintain the shoulder muscles, shoulder scapular muscles. So forward head posture in future, if they are suffering with the neck pain and if they neglect this, it may lead to chronic headaches, back pain, increase in curvature of the spine. I have shown you how the spine curvature will changes. Early onset of arthritis, nothing but spondylosis, decrease in lung capacity, about the breathing capacity also, muscle damage. Muscle damage, this is nothing but anterior cervical muscles weakness, posterior cervical muscles tightness. Nerve damage, so arthritis may leads to nerve damage. Based on the nerve damage, the nerve tingling sensation can be seen over the hand. And disc herniation, prolonged weight over the spine. So it may leads to disc herniation and compression. So these are the references which I have taken all this text neck syndrome. So if you have any queries about this, about the exercises, you can contact the Buddy for Health to reach out of me. So any questions you can ask me.
You can raise your hand so I can unmute the any attendees if you want any questions.
So I have a question. What is the difference between arthritis and spondylitis?
Ma'am, arthritis, it is equal to spondylosis. We will be telling cervical spondylosis is different from cervical spondylitis. Spondylosis means arthritis only where the bone changes, structural changes can be seen. Osteophytes can be seen. Because of these osteophytes, there will be inflammation to the nerves. So I will show you in one slide. The cervical neck X-ray is there. No? Can you show that slide, please? I can explain in detail about that. About the X-ray of cervical spine, normal posture and forward head posture. So, cervical spondylitis is inflammation to the nerves leading to cervical spondylosis. Cervical spondylosis is nothing but changes in the vertebra of the bone, either vertebra of the bone or the spinous process. So, the structure of bone will be changed. So this posture, prolonged posture, it can lead to cervical spondylosis because repeated strain over the muscles. So the muscles cannot bear the weight of the spine. So indirectly, it is putting further more pressure over the spine, which is leading to structural changes of the spine. So this is how young age only we are seeing cervical spondylosis more number of cases.
Okay. Any other questions, anyone?
So one thing I want to give suggestion is every 2 hours, simple exercises, stretchings, whatever the stretchings I have shown, at least 10 times. It is very important. Every corporate official, if they do means they can avoid, they can prevent it. See, we cannot change the whatever the structural changes occurs in our body with age. So it is occurring at very less age only we are seeing. That is at 20 years only we are seeing cervical spondylosis. We can prevent it. So with age, the degeneration process, we cannot stop it. We can prevent the cervical forward head posture. So I already told this cervical forward head posture, how it is leading to upper crosset syndrome. Again, upper crosset syndrome, how again it leads to cervical spondylitis to spondylosis. So again, spondylosis, again, nerve compression will be there. If nerve compression is there, again, we will see numbness and tingling sensation all over the hand. Radiation will be seen.
Okay, thank you, Ranjita. Mr. Arvind wants to know any exercises that we can do during our office hours to reduce the effect of neck pain.
Yes, yes. I have showed you, stretchings, how the whatever the stretchings are there. So cervical stretchings, and also along with that exercises. Everyone shoulder structs. So I'll leave apart all these stretchings. So only one exercise is enough. It is very important. Shoulder structs. So lift your shoulders up. Count 1, 2, 3, 4, 5, and slowly rise it, lower it down. So, and also protraction and retraction. Also, I told how you have to do. First, you have to raise your shoulder and then retract, then protract. So this is these two exercises, if you do, and also some of the exercises, raising your hand every 2 hours, 10 times, and then keeping your hands doing forward and backward. So these are the 3, 4 exercises are there. So if you reach out to me, I will explain you in detail about these exercises also. But these are the 4 simple exercises. If you do for every 1 hour or 2 hours, at least 5 times to 10 times, you can prevent forward head posture.
Okay, thank you. Another question we have is from Mr. Ramesh. He wants to know if our company wants to do a webinar for our employees. Would you be able to conduct it?
Sure.
Okay, thanks. And second question is Mr. Vikas asking, can you once again explain how to detect neck pain, like a particular X-ray or a scan?
X-ray, there is a slide back how I have to go. I
Yeah,
have checked one X. Yes.
is this the correct one?
Yes, yes. This is the one. This is one only. See, this is the normal cervical X-ray, how the curve will be maintained. S-shaped curve will be seen. But if there is a forward neck posture is there, we can see this. So cervical spine straightening can be seen. So this is the madam also asked question. So these are the structural bones, how the changes takes place in spondylosis. If spondylitis is there, see these are the bones. These bones can irritate the nerves will be there. These can irritate the nerves. Any of the inflammation of the nerves may leads to spondylitis. Spondylitis can be seen in young age, 20 to 30 years of age. After 35 to 40 years of age, we can see cervical spondylosis because of changes in the bone structure. So this bone change or this cervical spine change can be seen in young generation group because of forward neck. See, this is the normal neck. So if you see prolonged period of time keeping our head forward, how much weight will be borne over the spine? The weight will it has to be maintained. So we consider the head as a globe and this is a ladder. So how much weight the ladder can bear the globe weight? So this is very important. So these are the some things we have to keep in mind. So if we have any call or any meeting also, after meeting, please do some exercises. So some neck exercises and also the eye exercises are there. Nothing eye exercises are. So keeping your eyes sideways, up, looking up and down, looking sideways. So these are the some of the eye exercises also where you can prevent headache and dizziness also. So if dizziness is present, it may leads to vertigo also. So when better to do the eye exercises also after any meeting or after any 2 hours, the exercises if you do, we can prevent it.
Okay, understood. Another question is from Atharvi. Can we give Mulligan techniques?
No. See, Mulligan techniques we can give, but based on the patient condition, individual condition. So some, if you give for a patient with cervical spondylosis, so if he is an expert physiotherapist, so he can rule out the cause, exact cause, and he can give mobilizations. So what we call Mulligan techniques as mobilizations. If there is any syndrome is there, cervical facet joint syndrome is there, we can give. But Mulligan techniques we cannot give for the age of people 40 to 50 years of age or those who are having 40 years of age. Those who are with young age, that is 22 or 30 years of age, we can go. But depending upon the condition, first we have to look at the spine, how the spine orientation is there. We have to see the cervical spine X-ray also. And based on that, we will go for treatment prescription also.
Okay. Thank you, Dr. Ranjitha. The another question is from again Mr. Arvin. He's asking, do chairs with arm rest help with elbow degree?
That's what I'm telling. The chair, whatever, if you are sitting, the arm, the elbow should be in 90 degrees position with the keyboard. It should not be high or low. So if you have 90 degrees position with arms by the side, the shoulder should be in adduction, arms by the side, and elbows at 90 degrees, we can prevent to some extent the forward head neck posture. But if the prolonged period of time we cannot sit in this position, holding the arms by the side of the chest and keeping the elbows at 90 degrees, we will be changing our positions continuously.
Yeah, right.
Make a plan of chair, postural ergonomics chair available outside any surgical shop also it is available. So if you plan it to take that chair, it will be good enough for you to maintain the lumbar posture also. So further, this forward neck posture is one of the first sign to get the back pain also. So if you are not experiencing forward neck posture, you may get lumbar back pain in future. So here the spine is compensated. So already the posture is changed here. So in order to maintain the neck posture, lumbar spine is going into more strain. So further you can see back pain in future.
Okay, understood. The last question of this session is from Miss Geeta. She wants to know, if me or my colleague want to consult Dr. Ranjitha for neck pain, what is the way forward?
Yes, you can contact Buddy for Health to approach me.
Thank you. Thank you. I just wanted to add further on the question asked by Mr. Ramesh. Yes, we do dedicated events and health camps for corporates, housing society, or large institutions, or even for health clubs. Just feel free to contact us for more details and we will get back to you.
Sure.
Any other questions? So now we have a special offers on our services for attendees, and probably you all have been waiting for. These are the services offered by Buddy for Health for our attendees only, and it is valid till 24 to 48 hours. You can enjoy a special discount of 500 rupees when booking for couple or making a booking for 2 individuals. And corporate employees or any large institutions or housing society can avail a generous minimum discount of 30% on our exclusive corporate packages or health checkup packages for a limited time. Over to you, Dr. Ranjitha.
So these are the services where I am providing online. So services like pain management for neck, spine, back pain, shoulder, knee and foot. So, and I did my specialization even in sports also. So I will be dealing with the sports athletes also, making them customized exercise prescription plans and nutrition plans. And especially for women, I will be concentrating on women who are at 30 to 50 years of age group of yoga. So explaining them about the yoga and also diabetes yoga, those who are suffering with diabetes. So giving them 12 weeks online consultation for diabetes nutrition and exercises. So this is a 12 weeks program is there, online program is there. So based on the weight, height, and the individual, I will be planning the nutrition program for diabetes people also. Even for obesity, also there is a nutrition plan is there. So I will not ask the individuals to go for that you have to eat this thing, that thing. You can eat everything, but you can eat within a limit. So with that we can maintain a nutrition plan and reduce the obesity and diabetes also. So, and also I thank you, Buddy, for health, giving me opportunity to explain about this text neck syndrome and also my services.
Thank you, Dr. Ranjitha Naini, for such a valuable session. You can contact us, attendees. For attendees, I'm telling, you can contact us at marketing@bodyforhealth.com or just customer care number present on the slide. If you have any questions, just raise your hand so I can unmute. Thank you everyone for your valuable time today. And thank you, Dr. Ranjitha and the attendees. We are now ending the session.
Okay, thank you. Thank you, everyone.
Thank you, doctor. Thank you. Thank you so much.